Hello and welcome to this live and interactive web stream. I'm Georgina Burnett. Now, incontinence can be a debilitating and embarrassing condition, but it's far more common than you may think. Here to offer some tips for dealing with it as well as managing the condition is continent care expert Kathy Howard and Jan Chaseley, and senior bariatric and women's health physiotherapist at BMI Alexandra Hospital, Sarah Hawkins. So welcome to you guys.
Thank you. Thank you.
Now, we're live today, so if you have any questions for our panel, please use the box on your screen and we'll do our best to tackle them over the course of the next 20 minutes or so. So first of all, Kathy, is incontinence a wider problem than we realise? Are people suffering in silence, do you think?
Yes, people are suffering in silence and suffer in silence for a long time, and in some cases for a number of years. I had a patient recently that suffered for up to 15 years. But it's estimated that between there's 3 and 6 million people who suffer from urinary incontinence. 1 in 3 women and 1 in 5 men. So it's important that they're aware that there is help for them.
So it really is a wide issue, isn't it?
A wide issue, yes. Very much so.
Jan, what causes incontinence in the first place?
Triggers for incontinence can be things like obesity. It's important to watch your weight. With incontinence, things like stress incontinence are going to be caused by childbirth, then aggravated, say, through age and the menopause. With things like overactivity incontinence, triggers are going to be caffeine drinks and all things like that.
And how mild or extreme can the symptoms be?
The variety can be huge. You can be talking about somebody who maybe just has a small leak of urine in an exercise class once a week, and actually for them that's manageable. And then you're talking the other extreme, patients who every time they need to empty their bladder, the urge is so strong, they're not making the toilet, they're leaking, they're having to wear pads. It's then affecting every part of their lifestyle.
So what are the different types of incontinence?
Different types of incontinence, you're looking at what you call overactivity incontinence or urge incontinence. That's where the bladder muscle will give a strong squeeze before it should be, so before it's ready to empty, causing a leak. The other incontinence is stress incontinence, leaking with coughing, sneezing, exercise, as I've already said, often common after childbirth. And some patients will have a mixture of the two, so they're struggling along with both.
Now, we often hear about women suffering from this, but men do too, don't they? So what sort of symptoms do they have?
Men will be getting up more frequently at night. Maybe when they go to pass urine, they might be straining. They might have to stand on weights, which we call hesitancy. They may pass some, as they get older, there's some prostate problems develop, so they may pass blood in their urine, or they may have urinary tract infections, or some leakage of urine. So it's important that they seek help as well and have their prostate checked out.
So other than the obvious physical effects, what would you say the emotional effects are?
I think actually the emotional effects probably have a bigger impact sometimes than the physical symptoms. You're talking about effects often on relationships. Patients will often say, actually, my husband doesn't know that I leak and I'm wearing pads. It's embarrassing. Social life, patients will stop going dancing, they'll stop going to the theatre, they won't necessarily go to a new place because they will toilet map. I can go to this place, I know where the toilets are. It's going to have financial implications and actually work implications. I've had patients who have lost their jobs because their bladder problem has meant, I had a lady in the bank, you've got to keep leaving your station at the bank to go to the toilet, and actually you can't always adapt around things like that. So it's huge, physical symptoms and emotional symptoms.
So it really limits your life if you don't address it.
Absolutely.
Yeah. Now, Sarah, we'll look at some exercises that people can do in just a moment. But first of all, what generally can people do if they're suffering from incontinence?
Well, I think one of the most important things is to actually look at a patient's fluid intake and make sure that they're actually drinking only between 1.5 and 2 litres a day rather than actually drinking too little or too much. I think too little is often what happens because in the same way that they're toilet mapping, they also don't want to end up having to go too often. So a lot of patients tend to be quite dehydrated. That can then lead to constipation, which then, if they're constipated, that's going to cause more problems with doing their pelvic floor exercises. So, looking at their constipation and their diet as well. And also generally good health, good food, not eating too many ready meals, and also trying to lose a little bit of weight. And just really becoming slightly sort of more healthy will actually help with your pelvic floor as well as everything else.
Yeah, so generally great advice there. So don't forget this is live, so we'd love to hear some of your questions. So all you need to do is fill in the box on your screen and we'll do our best to answer them. We've got a question here from one viewer. Continence care advice tends to be geared towards women. Is there any specific advice you can offer for men who suffer?
Kathy, do you want to?
Yes, for men who suffer, they should make sure they're drinking adequately again during the day. The same advice is for women, really. If their nocturia increases, which means getting up at night, then they should seek advice from their GP and have their prostate checked out. That's important as well.
Okay, so it's about really addressing it.
Addressing it.
Yeah.
It's really about addressing it.
Okay, we've got another one here. Can you advise me on whether there are any good foods or drinks that I should be including in my diet to help with this, or anything to avoid? So we've talked about some of the things to avoid. Let's just go through that again as to what you could have that's better for you and what you should be avoiding.
I mean, I think the advice that we give patients is to say no more than 2 cups of caffeine drinks in a day, and bearing in mind you're going to get caffeine in things like hot chocolates, in fizzy drinks, as well as your teas and coffees. So switch to decaffeinated drinks, look at having fruit teas, herbal teas, looking at having, fruit juices, water. Don't forget that you should be having water. And with the diet, avoiding the ready meals, look at things that's got too much in the way of additives. It's got a lot of additives in, it's going to have an effect somewhere, and it will irritate that bladder muscle. And people will get very good symptom improvement with those very, very minor, really, lifestyle changes.
So that's food and drink. What about general lifestyle changes? Let's just go through that, because today's modern life probably isn't very good for this, is it?
No, I mean, I think general lifestyle changes are, a lot of that is involved with the food and drink part of it, because as Jan talked about before, if you can't actually leave your desk, or you don't want to lose your job, you're struggling to keep your job, then you're obviously not going to be you're not going to be drinking enough. So that's going to be causing problems. I think a lot of people have very sedentary jobs but also work long hours, so that obviously stops them from perhaps exercising, and then maybe also seeking help, because they're not able to get to the GP or their continence advisor, because obviously the times don't fit in with their lifestyle. They're running around after their children, and that they just haven't perhaps got the time. And I know a lot of young mums say that they know they should be doing their exercises, but actually I haven't got the time to fit that in. So seeing a continence advisor who can explain to them that it doesn't take a lot of time to do their exercises if they're doing them correctly, they could probably actually manage to fit that into their daily life if they knew what they were doing.
Now, Kathy, as a care advisor, you probably come across a lot of people who are suffering from this. What are the sort of things that they have in their daily lives as a result of suffering from incontinence?
They can't go out. They're confined to their homes. They won't go visit any friends. They isolate themselves. They don't even want their family coming to see them at times because of the odour, and they feel if they do, their family will be asking them to seek advice. They're too embarrassed to seek advice. They can't go on a car journey. They can't go on a bus ride. Again, like Jan and Sarah has said, it's toilet mapping as well. So it is quite isolating for some people.
Yeah,
They have no quality of life.
Yeah. And what sort of experiences have you come across, Jan?
You hear a variety of experiences from people. I think the positive things to take away are that these simple lifestyle changes are definitely going to make a good improvement. But you do need to seek help. Don't ever think, well, actually, I'm 50 now, I had 3 children, I'm just going through the menopause. This is a normal part of ageing. Yes, these symptoms are going to be worse because you're ageing, but there's something you can do. And actually, even if you're at that extreme end where actually your symptoms are very debilitating, and maybe there's not always something that positive that we can do to cure them. One small little change could actually mean the difference if you're getting to the shops in half an hour and getting home without leaking. It's just positive changes.
And how do you think we can react as a nation to this kind of condition, to people that are suffering from incontinence?
Encourage people to come forward, and there's lots of help out there, not to feel embarrassed to go to their doctor. There's the Continence Foundation, there's the Cobb Foundation. There's lots of help if they would seek advice, and certainly there's a continence advisor in every trust.
Okay. Great advice there. Now, Sarah, one of the important things is exercising, actually, isn't it? So we've got some diagrams that I'd just like you to talk through the sort of exercises that people could do if they suffer from incontinence, but also, presumably, to avoid having it in the first place.
Yeah, certainly. The first two diagrams are just to show in a man and then in a woman where the pelvic floor actually sits. We describe it as a hammock. It forms a hammock basically at the bottom of the pelvis and supports all the organs inside. So
that red section there.
So that's the red section there. So that's in the man. So the muscles go from the pubic bone and then right through to the base of the coccyx. And then in the female, you'll see that that's a very similar. They look very similar. They're in the same place. So that's one thing that I want everybody to take away, is to realise that actually men and women do both have pelvic floors. A lot of the time, a man doesn't realise that he can actually help himself with continence because he feels that, oh, well, my wife had pelvic floor exercises when she had a baby, but I don't have one of those because I don't have babies.
Right,
so
yes,
it's important that men know that their pelvic floor does the same job, supports the organs and assists with continence, and also the pelvic floor muscles also have quite a lot to do with, as far as a patient's sexual relationship is concerned, sort of enhanced enjoyment. So we can work on that too. So that's one of the bonuses we can work forward to. So once they've got the pelvic floor improved, then that's going to help that as well, and obviously in their relationships, as Jan said, to stop the leaking. So that's where the pelvic floor is, and that's what we work when we work the pelvic floor exercises, so in the red. The next diagram I've got is actually of a female body, but it actually shows the action of the pelvic floor. So when we say these are the muscles we're wanting you to work, they're actually moving slightly upwards and basically slightly forwards. So if we can see the movement now, as the patient tightens their pelvic floor.
This is an action that we should be practicing all the time.
Yes, to imagine that when I teach pelvic floor, as do Kath and Jan, so what that does is the pelvic floor tightens and moves forwards and upwards, and then goes back. And what that does is it moves the bowel and the bladder, the bowel and the bladder slightly forwards, the tubes from those, and that causes those to close off to stop leakage. So that's why we're trying to get them to work them. Best position to do the exercises is to start with. We tend to teach patients to lie with the knees bent up on a couch or on the floor at home, trying to imagine that they're actually stopping themselves from passing wind to start with, and then imagining they're stopping themselves from passing urine.
Oh, right.
With men, often to feel the action, if they imagine what it feels like when they walk into a cold pool, their genitals tend to actually lift and squeeze, and that is the sort of movement that they're feeling. And what we do is we would generally, if a patient allows us to, we will do an internal examination to assess the strength of the pelvic floor, and it will be very much an exercise program that is individualised. So a lot of the information you get on the internet is actually do the exercises, hold the muscles for 10 seconds, relax for 10 and so on. But actually every person is different. So if we could get patients out there to actually, seek help and see a specialist, that exercise program will be geared to them individually, and we'll probably build up to more exercises for them, but start small and build them up. And that's why we feel that it will be good for them to see somebody who can actually do that with them.
And these exercises are suitable for men as well?
Yeah, same exercises for men and women. They only need to do about 10 contractions of the muscle once they know what they're doing, twice a day, 3 times a day if they can. And once they get on top of that, it's a case of really doing it for at least 3 or 4 months. They're not going to get an immediate result. So don't do it for a month and say it hasn't worked. It's very much keep it going. Once you've got them to the optimum strength, it's a forever thing, really.
So it's like with any muscle, isn't it?
Yeah, it can be
really
strengthened, as is the biceps or the quadriceps muscle. It's a muscle that can be strengthened just the same and maintained by continuing the exercises.
But this muscle really affects your lifestyle.
Yes.
So important.
Yes.
But we've got another viewer's question. I find myself going to the toilet during the night. Is there anything I can do to help with this? Kathy, what do you think?
I think they need to look at their fluids that they're taking in during the day, because quite often they don't drink adequate fluids during the day. So when they come home from work or from whatever, they start drinking late at night, and then they perhaps get up more often at night. Again, they should really finish their last drink about 8 o'clock at night, and make sure it's not a coffee or a tea.
Right, so it's gradual fluid intake through the day, not too
yes.
close to night as well.
Yes.
And Jan, somebody's asking, are there any early symptoms I should look out for?
I don't think there's necessarily early symptoms. I think the tendency is you dismiss it as being normal. So actually, I mean, ideally, if you're drinking the 1.5 to 2 litres that we're talking about, you should be emptying your bladder between about every 3 to 4 hours during the day. So if you're aware, actually, you're going about every 2 hours, you're probably going slightly more often. Get in the habit of being aware, actually, if I've got this urge, do I need to go now? Can I try and put that urge off? And we teach people, I don't know if Zara does the same, what you call a deferment technique. So if you've got that urge, squeeze your pelvic floor muscle, squeeze it really hard, hold it for a while, relax it, and then carry on with something else. Carry on your work on the computer. If you're shopping in Sainsbury's, carry on with your shopping. That urge will calm down, because the more often you empty your bladder will start to think, oh, I'm only supposed to hold a cupful of urine, whereas I should be able to hold nearer a pint. So you can do a lot of those early things. Just sort of be aware of the symptoms and pick up on things that you can do to potentially stop things getting worse.
That's very helpful. Sarah, what can we do as friends and relatives of people who are suffering from incontinence? What can we do to help?
I think the most important thing is to find a way to actually allow people to be more open about this. It is a taboo subject, but it really shouldn't be. It's something that we all have to do, and I think it may well be that if somebody mentions something, or we could maybe point them in the right direction of something on the TV, or perhaps if one of our friends maybe mentions that, as Jan said, they are going to the toilet more often, or even if they're with us and we spend some time with them, or elderly relatives, perhaps say, well, these things can be dealt with. Have you thought about talking to somebody? And at that point, they might actually go and perhaps speak to their GP. I think if we're aware, and then we then spread the word, and everybody who's a professional, perhaps, even if they're not specific continence advisors, could maybe say, well, have you talked to somebody or something like that, and just spread the word so it's not taboo.
Yeah. That they don't feel alone.
Yeah,
Yes.
I think it's not to dismiss it, not to just presume, well, actually, it's a normal part of ageing, to acknowledge, well, yes, it possibly is, but what can I do positively to help it? Not be afraid to speak to your GP, not to have gone to your GP with something else and wait till you're out of the door to say, oh, actually, by the way, I'm having this. GPs have heard it all before. They can give you advice. Just seek that advice. It is out there now.
And give emotional support, I guess.
Absolutely, yeah.
We've got another question from a viewer. What are some of the main misconceptions around incontinence? That's a good question.
I think misconception around it's a normal part of ageing, which I think we've talked about. There are a lot of things that you can do. And I mean, if you're looking at maybe something like stress incontinence, maybe you've tried pelvic floor exercises and they've not worked. To know actually there are other things that can happen. You can have surgery for stress incontinence. If you've got an overactive bladder and the sort of things we've talked about, the fluid advice, bladder retraining doesn't work, you can look at taking medication, and your GPs, continence advisors can advise you against that. About that. So I think there's always another step that you can go to. Don't just think, well, this is what it's like now and it's going to be like this for the next 30 years. There's now a lot more things coming out year by year, positive things that can be helping.
Fantastic. Well, we've got another question from a viewer. That's interesting. Is incontinence hereditary?
We do take family history, yes. It can be, and that's why when we're doing it, that's very important when we're taking the individual patient's history, that we take family history into consideration. Yes.
But it's not necessarily a given that if your mother, your father had it, that you will suffer from it. Particularly if you make those lifestyle changes.
Exactly.
Well.
Yeah, absolutely.
One of the things, my personal question, is it just a given that once you've had a child or children that you're likely to suffer from it? Would you say, Sarah?
I don't think that you're likely to suffer from it. You're probably just, it would be more likely if you'd had children. But a lot of the time, I think now people are a lot more aware, and I think obstetricians and midwives are a lot more aware that if a lady has an episiotomy, a cut or a large tear, that they're actually picked up early and then sent to a continence advisor, or even the midwife or the health visitor or whatever who's visiting them will say, look, we've identified that you've had quite a lot of stitches or quite a lot of damage. We need to actually get you seen now rather than leaving it. because otherwise I'm starting to see, and I'm sure these ladies do, these patients who are coming back as they start their menopause and going back through their own history, they then say they had a very quick delivery, a very large baby, and somebody said I had a bit of a tear, and I don't really know. So I think a lot more knowledge now that midwives are actually advising ladies that, you know, you should be doing this now rather than, you know, later on in life. And perhaps they can do some of the things like exercises and lifestyle changes in case they want another child. And then after another child, maybe they can then consider some surgery if that hasn't helped them.
But it's never too late to start
to
start the exercises. Don't forget, guys, that this is live, so we really would love to answer any of your questions. All you have to do is fill in the box on your screen. We've got another question from Julia this time. She's 33. She says, but I do think that I have an incontinence issue, as I often get up twice in the night, and certainly as soon as I open my eyes, I need the toilet. And this has been happening for the last 2 years. I don't drink more than normal. If anything, I drink less than I should. Could I have a problem, or is this just an age thing? What do you think, Jan?
Well, I mean, she's only 32 now, it's definitely not an age thing.
Right.
I mean, I think she's maybe answered her own question there, saying maybe I don't drink enough. I say that misconception that actually if I drink less, I'm going to need to go to the toilet less. That won't work, because the urine that you are going to make, the kidneys are going to make urine all the time. That urine's going to be slightly more concentrated. That's going to irritate inside the bladder, is ultimately going to irritate the bladder muscle. So make sure you are drinking enough. A lot of people will have a lot of strong urge first thing in the morning, and it's looking at not drinking too late in the evenings, the things that we've covered before. But I just think it's really good that she's aware that there may be a problem. Start working and strengthening your pelvic floor now. Start looking at your fluids and all the advice we've talked about.
Yes, the opposite to what you think. Drink more water.
Absolutely, yes.
It will help.
Yeah.
Another question, is it common for people in their 20s or 30s to suffer from incontinence?
Younger people can suffer from incontinence, and it's important again that they come and seek advice so we can teach them how to do their pelvic floor exercise at a young age. In Burma, the young children at school are taught their pelvic floor exercises at the age of 15. So yes, it can happen, and it is important again that they seek advice.
Well, like we've said, it's a muscle. It needs.
Yes, it's a muscle that needs to be strengthened.
Yeah.
Yes.
Interesting. There's a message from Pat. Why do I want to go to the toilet when the word toilet is mentioned, or if I see a toilet when I didn't seconds before, and what can I do about it? So it's kind of the trigger of seeing the word toilet, which is interesting, isn't it?
Yeah. A lot of people will say, actually, I didn't think I needed to go the minute that tap runs. And again, it's that association of that bladder muscle potentially just being a little overactive. Basically, if you didn't think you need to go, just because you see the sign toilet, you know, you don't need to go unless your bladder is giving you a strong urge that you need to go. And also bear in mind, actually, as the bladder is filling, we get what you call the first desire to pass urine. So that basically means your brain is registering your bladder is filling. You will need to go, but it will be when you've finished your shopping, it will be when you've finished the ironing, it will almost be convenient to you. So it shouldn't be, actually, I need to go and I need to go now. So don't always go just when you get that first sensation. Wait until the bladder's full enough and is holding a good enough volume. But a lot of people will say, I suddenly see the sign toilet, or actually, I've gone into Sainsbury's, I need to go first. You don't always need to go, just in case.
For me, it's always, there's never a toilet there when I need to go. So. We've got a question from Julie. If you need the toilet, should you go? It's probably pretty similar to what you were saying. Should you go as soon as you feel the need? I often wait until I'm completely desperate. Is that bad practice? I think you've just answered that.
Absolutely,
really.
But it's not waiting until you're desperate. It's just, I think it's knowing your own body. You know, if it's only been an hour since you last went, you probably don't need to go. If it's nearer 3 hours, then actually, yes, you probably do.
Now, is there any danger of holding on to it for too long, though, Kathy?
Yes, you can hold on for too long, so it's important that you don't do that because you'll overextend your bladder. So a bladder can hold up to 500 mils, so it's important that you probably go every 3 hours, 3.5 hours maximum during the day.
Right, so
when
it's
you
being
get
sensible.
Yes, it's being sensible. When you get the first sensation, like Jan just said, ignore the first sensation, try and hold on for another while, but not to hold on for hours and hours and hours.
Okay.
Yeah.
So don't leave it to your.
No, don't leave it because you'll
desperate.
overstretch the bladder.
Yeah.
You'll overstretch the bladder.
That's interesting. We've got another question. I'm not sure if I have any problems, but I feel like I need to go to the toilet every half hour. Do I have a problem? What do you think, Sarah?
Yes, I think it may well be, as Jan's just said, it's you feel that you've got a problem and then you don't want to actually leak, so you actually go just in case because you're worried about leaking. It could be that. It could be that somebody's actually had an accident in the past and then you're so worried about that happening again that you're quite anxious about it. We would look at the pelvic floor, we'd probably look at the diet, we'd look at the fluids. It may well be that this lady is actually not drinking enough or she's drinking a lot of caffeine. So that she should probably seek help in that case if it's that often. And we could try and teach her some of the deferment techniques that obviously maybe nobody's mentioned to her, or possibly, a lot of people don't actually know that we can help in that way.
Yeah,
do you
it's
agree,
about
ladies?
seeking help,
Yeah.
isn't it?
Yes,
Yeah, I
it's
think in that
seeking
case.
help because there's lots of investigations we would do. Yes.
So it's not just about the
Yes.
lifestyle
No,
changes,
no.
actually they're experts.
And actually following on from that, if that's a new symptom, then actually just maybe see your GP, make sure you haven't got a urinary tract infection.
Right,
Something
yes.
actually quite simple that could be treated.
Right, okay. Another question. This is probably for Sarah again. How effective are the pelvic floor exercises? How long will it be before I start seeing or feeling results?
I think the pelvic floor exercises are extremely effective if they're done correctly. And if you keep up with them on a regular basis, and also, as I said earlier, it's not a quick fix. So don't stop after a month. Keep going at least 3 or 4 months, 3 months minimum. And then at that point, we would hope that you'd be at your optimum level. And then it's a continuing thing. So don't stop. Keep doing them. As in any other muscle in the body, it weakens if you don't actually do the exercises regularly. So probably, depending if you're doing them on your own, then there will be certain things that you'll know that things are improving, but don't look for a massive improvement for at least 3 months.
And the maintenance is much easier than at the start.
Yes, I mean, as far as the maintenance is concerned, you'll get to the stage where you should still be doing them on a daily basis. But I think if anybody's training for a marathon or training as a sprinter or anything, they're not going to get to the stage where they can run the marathon. They're then going to, if they might want to do it again, so they're going to keep up with the regular training. And it is just the same with the pelvic floor. It's an ongoing thing, really, for life, if possible.
Okay, so I'd like to ask each of you your final piece of advice. Kathy, first of all, to somebody who is suffering from incontinence or thinks they may be suffering from incontinence.
The advice is, again, as we've all said, is to seek help. There's so much help available, and incontinence is so manageable. We can do so much to help people, and they mustn't suffer in silence. It affects their quality of life tremendously.
So you don't need to suffer in silence.
Don't need to suffer in silence.
Yeah. Jan, what would you say?
I think I would say take on board all the things that we've said. There's a lot of positive, easy lifestyle changes that you can do that can make a significant improvement to your symptoms. Try those at home first. Actually, if they're not working, then maybe you do need to be seeking, a second opinion and specialist advice.
And Sarah, finally, what would be your advice?
I think, obviously, as Jan said, try all the things at first, but often, if you're not doing your pelvic floor exercises correctly, you could, in fact, possibly make things worse if you were actually bearing down rather than lifting up, or you wouldn't be actually helping yourself. So if you're feeling that you've tried them, because maybe your neighbours said, look at that website, or somebody's given you a leaflet you've picked up at the GP surgery or something, and you feel that, you really aren't improving, then go and get an assessment and speak to somebody, one of our professional teams, and then, get an exercise program specifically for yourself, and then you will see some improvement at that point.
Great, fantastic advice there. Well, we've run out of time. My thanks to Kathy Howard, Jan Chaseley and Sarah Hawkins for joining us today. If you'd like to continue with your questions and thoughts related to dealing with incontinence, why not join your Benenden Health online community at secure.benenden.co.uk/suite/apps. Click on the community tab to share and discuss with other Benenden Health members. Thanks for watching and goodbye.